Welcome to the Dutch Podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. The information is not to be interpreted as or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, or treatment.
You are going to love today's Dutch podcast. I sure enjoyed my time talking to our guest today. I talked to Dr. Craig Koniver. He's a performance MD in South Carolina. And what I loved about this podcast, and what I think you're going to really love, is we talked about how so many patients come in because they notice a gap between the way that they feel and the way that they think they should feel, or the way that they want to feel. And we talked about all the different ways that you can get from point A to point B. We talk about assessment. We talk about lifestyle. A lot of the things that he emphasizes as being the most impactful are things that are completely free, but can be a struggle for a lot of us. We also talk about the most cutting edge therapies that are available in the market today and how these can be stacked to really optimize performance. So I won't keep you waiting any longer. Let's go ahead and get started with introducing today's guest. So I'm very excited about our guest today and the opportunity to introduce him. Dr. Craig Koniver is over 20 years experience in performance medicine. He graduated from Brown University, earned his medical degree from Thomas Jefferson University, and then completed his residency at the Medical University of South Carolina, which is where his practice is now. Dr. Koniver focuses on improving internal and external health, really using a wide variety of up-and-coming therapies and well-established therapies to optimize the body's potential. He's also trained and mentored hundreds of medical professionals in performance medicine and aesthetic medicine at his Charleston facility. So I'm so excited to get the chance to talk with you today a little bit more about your practice and about performance medicine and what patients are asking for and what you're providing. So welcome today to the Dutch Podcast.
Yeah, thank you guys for inviting me. Happy to be here.
So I'd love to start by just understanding, like, what is a typical patient coming to you asking for, complaining of, what brings them to your practice?
I think the majority of our patients are the well who want to be super well. We certainly see our fair share of patients with complicated medical problems who are either fed up with the conventional medical system or not getting the help they think they need and looking for outside the box therapies and thinking for sure. But I think the common denominator beyond that is, it's the peak performers of the world. It's whether it's someone who's a professional athlete or a weekend warrior, it's people who like to excel, execute, and achieve.
That's cool. So tell me, are there some like commonalities amongst those people that are like, what are those things that are kind of preventing them from getting to the next level?
I mean, if I'm going to be totally honest, it's the type
Please
A.
do.
Yeah. It's the type A people who don't know how to put their foot on the brake.
Okay, definitely. That's interesting because this morning I went to a restorative yoga class thinking myself that I was one of those people and I'm not doing enough break work.
But this is why, to get right into it, this is why I love the Dutch test. And this is why we're going to be doing more and more, is because understanding someone's, how someone internally is handling stress in their universe, in their world, to me is maybe the most important aspect to understanding them as a human.
Yeah, I'm so glad that you brought that up, and thank you for mentioning the Dutch test. Of course, we have this area of the HPA axis, which is what I think you're referring to, kind of this more complete evaluation. And it is so interesting because you see a lot come up for people where they might be surprised because they don't perceive themselves as being under stress. And I think, everyone has a different level of resilience. And typically these high performers can take a lot before they break. That's what's allowed them to kind of get where they are. Um, but we all have a pushing point, and also sometimes our own like mental, emotional perception of where we're at is very different from what's happening physically. Have you seen that too?
Totally. I mean, I think with these people who are high octane, they're used to, and what served them well is the grit, the working hard, not taking time off, always thinking about work, always pushing. These are the types who feel like it's additive, right? And I think that's the message from a lot of podcasters and influencers, is it's additive. Like, you got to do all the peptides, you got to do all the hormones, you got to do all the sauna, the cold plunge, the high intensity workouts, you got to eat a certain way. And if you don't do all of it, you don't do any of it. And I just find that that's very stressful for people.
I mean, it's a lot when you think about all the things that you could be doing and then you're doing that on top of a job and on top of a family and on top
Right.
of everything else going on in your life. It's like a full-time job to be well. What are
I
the
agree.
things that really stand out to you of like those core foundational pieces that people need to start with before you even layer on? And I've heard this described online, which I think is great. It's like if you're doing the cold plunges, but you're not, meditating or eating well or kind of managing the basics, you're focusing on the cherry and not the ice cream.
Yeah. I think like my perspective is what I've learned in my practice. It's evolved, but what I've learned is when people come to see me, what they ultimately want is to feel better first. And so that's what we work on first, is how to get someone feeling better. And I think that, at large, conventional medicine misses this point. Certainly when I was trained, and I trained and continued on today, it's all about getting the diagnosis.
That's right.
And the diagnosis, then you work the diagnosis, and you plug in medicines, or then you have functional doctors plugging in nutraceuticals. But it's the same paradigm of treating this for that. And in the mix of that, by and large, patients get lost because not that they become labeled as a number or part of the assembly line, but they're not being listened to in terms of what they want most. And I think for all of us at any stage in life, we just want to feel our best. So that's where I like to start, and we have success with that, whether that's starting people on peptides or doing hormone testing, or we'll talk about NAD. All these different tools are geared towards at first getting people to feel better. And then once people feel better, and again, I talk about this a lot, is then when patients feel better from the interventions we're making as providers, then they're going to have a little bit more trust in the advice we give them. And then they're going to want to start doing more of the heavy lifting themselves. Then they're going to be more reflective about what can they do in their life to continue on this path or make this path better. And I think that's such a key element, right? And in the conventional medical world, which is insurance based on this made up standard of care, which is absolutely failing and means nothing. If we look, not to get too serious about it, but it's horrible. Our standard of care
Mhm.
absolutely sucks. We're not making any impact on cancer, heart disease, neurodegenerative disease, autoimmune disease, right? Greater than 50% of our population is overweight, tired, depressed on multiple pharmaceuticals, but that's the burden. Like that's the standard bearer. And I
Yeah.
just don't think that's good enough.
You're touching upon a couple things that I really want to dive into and pick your brain on because I think they're really important points. The first one is I think this disease-based model of care that's
Yeah,
not enough for a lot of people. And I love that you focus in on, they're not feeling well. We want to get them feeling better because I think there are so many people who they don't really have a place where they fit in right now into the medical system because they feel like junk, right? I don't know what our rating is on our podcast. Can I swear on that too? I don't think you need to, but they're feeling terrible. However, they're not diagnosable with a disease, and I see this
I
like with
agree.
GI illness as a great example. There's a lot of people walking around with really dysfunctional gut that has a humongous impact on their life. They don't go out, they don't eat out because they're afraid to leave the comfort of home close to a bathroom that they're familiar with, or
Sure.
but they don't have Crohn's disease and they don't have IBD, and of course maybe they have IBS, but they don't fit into that diagnosis drug
Yeah.
solution process. And so they end up, it's like, and I guess the GIs don't really know what to do either, although I think that's starting to evolve a bit, but they get dismissed not because of their suffering not being real, but that's what it can feel like to
Yeah.
patients sometimes.
And I totally agree. And then I think even broader than that, to your point, is so many people with some adrenal gland, dysfunction. They don't have, Cushing's disease, which is excess cortisol production, and they don't have Addison's, is where they're not making enough cortisol, which is how the conventional world sees it. You're either black or white. There's no gray. The vast, vast, vast majority of us live in that gray. And
Yeah.
that becomes to me the cornerstone for helping people, is understanding that stress response and understanding the significance of how they perceive stress, and then how do they modulate that stress.
Yeah, and we're kind of earlier on in that late HPA axis model, transforming or getting a better understanding and language around the nuances, I think, compared to gut function that we talked
Yeah.
about first, because it is not just a black or white. However, I think some of the language that's been used historically wasn't scientifically accurate, like failure of the adrenal glands, which we know
Right.
they don't fail like an ovary does. They're not fatigued. There's just dysfunction and dysregulation. And we've kind of set ourselves back, I think, in the functional medicine world while we check ourselves and study a little bit more. And, the phenomenon is real and the way people are feeling is real, but the way we were describing it didn't make sense scientifically for a long
Yeah.
time. And I'm glad there's providers like you, out there we're starting to really change that language and help patients change the language, because it is certainly a very real phenomena to have dysfunction going on with your HPA axis. Probably one of the biggest things we see in this type A group.
I think it is the biggest. I would say it's the biggest. I mean, that's where, and I also, to me, it's the biggest, but it also provides the biggest window of opportunity, because it's not just helping people in the short term. Like, these are longer term issues that, like you said, like, you may be a peak performer and go all in on your career and all the things you're doing, but there's going to be a trade off, which there just is in life, and people burn out. And
Mm-hmm.
then they don't think that, like, the way they fix it then is to try harder, which isn't necessarily the way they need to fix it. And it's hard
Yeah.
for these people. I mean, I had a patient I saw just a couple days ago, very successful woman. I think she's 62, and she doing all the things, right? Like, all the things. She has all the contrast therapy, the sauna, the cold plunge. She's on peptides. She's on hormones. She exercises 6 days a week. And I asked her, I said, "What do you do for downtime?" And she couldn't answer the question. And she's like, why did I struggle with that? I said, "I knew you would." I said, "But because you value doing more than being, and you have and it's served you well. You've been very successful in your life, but it's not going to serve you in the next 30 years of your life. I can guarantee you, because it doesn't work that way." And she couldn't answer. Like, she didn't know, like, oh, and I call it deliberate, contemplative exercises, prayer, meditation, journaling. Like, to me, that's way more important than the exercise someone does. And I say that sincerely. And people are like, "No, no, no, I need to exercise." Like, you may need to exercise for sure. I'm not saying don't exercise. But if you don't put the attention on how to make your adrenal gland stronger and become more resilient to the cumulative stress that you experience, that's ever growing in a very complicated world, it will catch up to you faster than not exercising.
So why, in your experience, you've obviously talked to a lot of patients about this. Why is this so hard for people? Why is there such a disconnect? I mean, there's obviously
Yeah,
societal pushing to go, 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 but why does it feel like, you could go to 6 CrossFit classes a week,
right.
but then to consider journaling or meditation or a slower practice, it feels really daunting for people?
Well, I mean, to get philosophical, it's because we value material things more so than even emotional or spiritual things, right? So for I tend to disagree with a lot of people in this space who are like, okay, the way to longevity is by having the best cholesterol or the most muscle mass. I don't agree with that at all. I think the most important thing that people care about as they age is how much peace they have inside. And if that's not how you're, going about your day, your week, your month, that's fine. But I don't think you have as meaningful or fulfilling life. And that's been my experience. And it's hard for people because we reward doing.
Hmm.
That's all we do. We reward doing and accumulating, right? You're not rewarded for just being alone. Like, I just spoke to a patient this morning, and he came back from a 10-day silent retreat. Didn't talk, didn't have internet, nothing. And he said, what a gift he gave himself, but how hard it was, but how valuable. 99.9% of people would never do that. They'd say there's no value there to just learn how to be introspective. Like, I'm not doing, like, I have to be doing. And I think that's a lot of programming, but I also think that's what we value as a society, right? We like buying stuff, accumulating stuff, and we like getting the gold star.
It's almost like disconnecting yourself from the dopamine hits that you get from that type of external validation, and that might be things. It might be a car you drive, but it might also just be likes on social media, for example,
Totally.
that drive that for people. So, I mean, I love that our conversation's gone here, because I think it is getting really to the root of wellness in a lot of ways, and the root of stress management, and part of it is releasing the pressure you probably put on yourself
Totally.
to be listing those accolades. I mean, that's very relatable for me growing up as like the youngest child, overperforming at everything. But you get accustomed to that, and you
Sure.
have to really unbreak those habits.
Well, I think right, but I think it serves us. Like, I think people who are higher achievers, it serves us. But it reaches a point in my kind of estimation or observation of this is most people can handle that type of stress really into the fourth decade of their life. This is what I see. But usually around when people hit their 40s, it accumulates, and people don't realize it's could be things like you're eating the wrong food, right? Like you're having trouble digesting. That's a cumulative stress. It could
Mm.
be that you're exercising too much. That's a cumulative stress. It could be that you wound your nervous system so tight because you're responding to messages all the time. That's a cumulative stress, and it catches up with people, right? And I think when we're in our 20s and our 30s, for the most part, by and large, we're flexible from that. That what I tell patients is like a rubber band. Like you want to pull it, comes back to center, pull it, comes back to center. Well, eventually you're going to pull it, it's going to break.
Mhm.
And I firmly believe it's when it breaks. This is when, and I'm talking about our adrenal system and not being able to respond to stress, because cortisol is such a powerful hormone, reserve buffer, anti-inflammatory, you name it. When you break it, this is where heart disease, cancer, neurodegenerative disease, all of it starts, in my opinion.
Well, because you're really at that cellular level, not able to restore and heal at that
Right.
point, or your sleep gets affected. And then, of course, sleep is such an important time for us to be rebuilding and healing and
Yeah.
resetting. So, yeah, absolutely. It all plays in here. So, when you talk about people that are coming in not feeling well, are there
Yeah.
like 3 or 4 areas of health that are those first indicators that something is wrong at that, stress management level?
I mean, I think when the whole goal, the challenge, I should say, is that when seeing new patients is, are they going to be open and honest to tell you the
Mm.
truth, right? And I think that that's not talked about enough, because I think patients are guarded and reserved because they've been through the medical model where they're not listened to or validated. So, not saying that every patient lies, but I understand that they don't want to be totally forthright. So I think it manifests usually in the big things, like people say they're not sleeping well, they can't focus, they can't manage their weight, they have brain fog. But I think those are just symptoms of more underlying, core issues. But again, for me, we like to get people feeling better. So whatever it is, we want to start, meet them where they are, help them feel better. And once we do, hopefully, then they're going to be willing to open up and want to take that next step.
Yeah, that was another area that I wanted to just kind of re-emphasize. I love that you're bringing that up because as a provider, you have to fix what people care most about. And I think we've all sat at the table across from a patient where they are maybe they have this like incredibly high cardiovascular risk factor, but they're complaining about insomnia. And you as a provider know that you've got to manage these risks for them. They're a walking stroke or MI, but also they're not going to come back to you unless you fix what their problem is. And I think there can be that push and pull. And I love that you're bringing that up because it's really something that you have to learn and practice is like you have to build trust with patients, especially if
Yeah.
they have a long road ahead of them to healing. If you're only focused on what you want to work on or what they need to work on, sometimes you can miss the opportunity altogether.
And totally, and then to take it probably a different direction, but it's worth bringing up because it's coming, is, and I don't think providers realize this, but with AI and what's about to happen, like most providers are going to be out of a job
Mm.
if they do not learn how to bring humanity back to medicine.
Yeah.
That's
There I
just
mean,
a fact.
certainly you're right, and the providers need to be part of the medicine, and I think that's
They
an
are part
important
of it.
piece.
Yeah,
That relationship is critical, like, you
it's
are
all of
part
it.
of that healing journey, and I think that's
Yes,
not something to overlook or underestimate as we consider how we're present with people, how we're building
100%.
relationship.
Yeah. I mean, like you mentioned, we train a lot of providers over the years, which is something I really enjoy. And I get it. They come from this, and they're most of them are leaving some part of conventional medicine that they're dissatisfied with. Most of the time it's because of the insurance-based model, and they're seeing patients every 5 to 7 minutes. And you really can't make progress with someone. So they're feeling less than valuable. And what we try to help them learn is, you'll be more valuable when you'll be more present. And
Mm,
when you're more present, then your patient will receive that, and then they'll be more trusting of that relationship. And it's paramount. It's paramount. This is why people collect doctors now. It's very common. People don't have just one doctor. They say they have five. I mean, why is that? It's because they don't trust the people that they're talking to. So they're going to bounce things off of other doctors all the time.
mhm, especially the clientele that you're working with, because they wanna make sure they have the right advice.
Totally.
Yeah,
Totally.
and, with you're right, it's like with so much data out there, everyone can find the data. I think about that sometimes with, when you think I talk to providers when they're building a program or something, it's like anyone can actually go online and find all the information they need to
It's
lose
true.
weight or to whatever. But what you offer is how you uniquely put that together for them and make it easy and make it palatable and build that relationship to help them be successful.
I think, yeah, and I think it's hard for people to want to make change in their life, like you're saying, like people know what to do,
Hmm.
but the question is, why aren't they motivated to do it? I think it's in large part because they don't know what success looks like. Like literally have no idea that if they put in the time, energy, and effort in doing lots of different things, that it's going to lead to something different. So if you don't know what the map, shows you, or you don't know what success looks like, I get it. This is why it's hard for people to make change in their life.
Mm. Well, let's shift our focus a little bit because I'd love to
Sure.
talk a little bit more about your process.
Yeah.
When you're looking to optimize health for patients, I know you mentioned the Dutch test. What other testing are you typically running in this group when you're trying to really understand their full health picture?
Yeah, I mean, I think again, there's no perfect test, and so it's one is building relationship over time, so you can see data points that change, right? So, in an ideal world, we're going to do things at the same time. So we like to do serum blood testing at the same time as doing saliva testing, at the same time as you're doing urine testing, and sometimes we'll do hair testing as well to look like minerals and metals and those types of things. And so it feels more like you're understanding how the person is kind of operating in the world they live in, as opposed to blood testing is great, but it is just a snapshot. For example, if people do hormone testing, is literally a snapshot of what's in their bloodstream at that moment. And I don't know if most providers understand that. They're like, oh, this is their cortisol level or this is their testosterone. It must mean that. No, it means that at that moment.
Hmm.
And so then if you then, really get to know your patient and they're telling you things about their history and how they're feeling, and now you can look at their blood, but now you can see what their cortisol is doing throughout the day, how they're metabolizing cortisol, how they're metabolizing testosterone. Like that's more of a picture. Is it perfect? No. But if you get to know a patient and are on the journey with them, you can do that multiple times and make interventions and see how they respond.
Yeah, it's so interesting. I mean, and I thank you for bringing up that kind of saliva versus urine difference because they are looking at different things,
Yeah,
and I've always done, sorry, not saliva, serum. I've always done serum testing in my practice when I'm evaluating hormones because I think it is a really important baseline to look at, especially for females. They have menstrual cycles. We know where things should fall in specific days of the cycle. But again, like testosterone in men is such an interesting example because the fluctuations hour to hour can be upwards of 30%
yeah,
across the course of a 24-hour period for men. So, I mean, that is a reason why we like to look at urine because when you take 4 points and average them over the course of a day, you're getting area under the curve and you're less likely to get a peak or a trough that
sure.
misleads you as a provider.
Yeah.
Um,
No, I
yeah.
love that. I agree. I agree. I think there's some bias, right? People are trained a certain way, so they say one is better. No, I don't think any's better. I think it's actually the combination of how you can interpret them that makes
Hmm.
it stand out and makes it individualized for the patient. So
Yeah.
I like all of it.
Yeah. I agree with you.
Yeah.
Well, I want to talk a little bit about a couple of the therapeutics that you're using in practice as well that I think our listeners are really excited to learn more about. The first one's peptides.
Yeah.
Tell me a little bit about how you got interested in peptides and
Hmm.
what types of things you're using them for.
Yeah, so we started with peptides. It's probably been 8 or 9 years now. Um, I have some, high level athletes as patients. I remember some were really competitive CrossFitters came to me and said, "Hey, in this community of CrossFitters, these people who are really high level competing are using these different peptides." At the time, it was these growth hormone releasing peptides like semirelin, ipamorelin, and so that's how we started. And we would just, one peptide per patient, kind of see how they did and learned a lot. Now, the whole field has changed, obviously, in that time. Now there's so many different peptides. But we've been really impressed, number one, because of the safety profile. Like it's very hard to find a negative side effect of peptides. Now, there's certain ones you have to be more leery of and careful of. Some of the growth hormone releasing peptides, you have to have a little bit more respect and understanding. But by and large, I mean, you hard pressed to find a negative side effect. So one meets that criteria, very safe. And
Mhm.
then two, just doing a lot of it, we've learned that people respond really well. So by and large, people are going to get benefits within a matter of weeks. And that's huge. And then going back to that theory that to me, people want to feel better first. If
Mhm.
you can help them do that, and that's why I think peptides are a great accelerator of health and well-being, then they're really going to start to buy in more. And so we use a variety of peptides now, from growth hormone releasing peptides to anti-inflammatory peptides, immune modulating peptides, peptides for the nervous system, peptides for the mitochondria, on and on and on. What we like to do is combine them in kind of unique combinations, like stacking peptides. And we just have a lot of experience and absolutely love it.
So for our listeners, how do peptides differ from proteins?
They're just smaller. So peptides, by definition, are chains of amino acids. We call it a peptide if it's 40 amino acids or less in sequence. And we call it a protein if it's 41 amino acids or more.
And then tell me a little bit about how these are dosed, because I think there's injectable, there's oral.
Yeah. I think by and large, they're going to work best if they're injected. So we use them subcutaneously. We've also used a lot of peptides intravenously over the years. Very, very safe and have good results. But I think subcutaneous is the best. There's these regulator peptides that people are trying where they're very small, like 2 or 3 amino acids in length. That supposedly there's a lot of track record and help specific organ systems. We haven't seen the same clinical results at all compared to injectable peptides. So there's peptides, unfortunately the FDA came and banned most of the tried and true peptides in October of 2023. So they can't be compounded anymore. So people are able to get research peptides to inject, or you can get, over the counter supplement peptides that are oral. But again, our experience, oral peptides aren't going to work nearly as well as injectable.
Yeah, the FDA has been very active in like minimizing what can be compounded now. That's
Sure.
affected a lot of practices.
Oh, yeah. And a lot of
Another
people.
And a lot of people, a lot of patients too, who'd been receiving benefit from it, which is,
Totally. It's a big
understand.
blow.
Yeah, definitely. So another therapy that I want to talk about is NAD, because
Yeah.
this is another one that we're hearing a lot about, a really important nutrient. Is that something that you're utilizing in practice?
We do. We got lucky. I would say we started with NAD probably about 10 years ago. So we've been using it longer than most. And I've said before on podcasts, I think if I had to pick one compound that I would recommend to people, it's NAD, because as a singular compound, I've observed the most transformational changes in people's health in a very short amount of time. Like we've treated thousands upon thousands of patients with NAD. Doesn't work for everybody, but for the vast majority of people, there is an up-leveling of their nervous system to start. So people come back and say their brain is getting bigger, they feel more creative, they sleep less but have more energy, colors look brighter, languaging is easier. The thing is just, life is easier to navigate when your nervous system is working, at a higher level of efficiency, which makes sense, right? Because there's not just one mitochondria per nerve cell, there's thousands.
Right.
And it seems that we know from academic research over the last 5 to 10 years that as we age and stress out our bodies, we can't keep up with NAD demands. And so as you add NAD back to the system, we have good things that happen, like really, really good things. We're big, big fans.
So let's talk a little bit more about NAD, like as a molecule.
Yeah.
And you mentioned mitochondria and it's kind of its relationship, because we have not covered this on our podcast before.
Okay.
And I think listeners probably have heard about it elsewhere, but start with at the beginning. I mean, this is
Yeah.
like metabolite and a coenzyme that we make on our
Yeah.
own.
So I just break it down to keep it very simple because it's
Great.
easy for my brain. So there's 3 ways that we're basically making ATP energy. The first is glycolysis, right? We break things down to a glucose molecule, which is 6 carbons in length. We split that glucose through the process of glycolysis into 2 pyruvates. Each pyruvate's 3 carbons in length. As a result of that split, you get a mild, making of ATP.
You're bringing me back to biochem
I know.
first year med school.
Right. And then you take that pyruvate, it's converted to acetyl-CoA. This is happening in the cytoplasm. This is not in the mitochondria itself. Then you take that pyruvate, you convert it to acetyl-CoA. That acetyl-CoA is run through the Krebs cycle, right? And through the Krebs cycle, you're making these intermediate molecules. One of the big ones is NADH. And you're also making some ATP. Well, now that NADH and some other of these intermediate molecules are shuttled to the mitochondrial membrane, where we undergo oxidative phosphorylation, right? And so the way I think about this, there's 5 hubs that sit on this mitochondrial membrane, and the goal is to exchange electrons for protons so that eventually we can get to the 5th hub, the 5th cytochrome, which turns the ATP wheel, and you're maximizing your ATP output. It's so NADH is used at cytochrome 1, or that first hub. Now, why do I think it happens? Again, oversimplifying it, I think the traffic jam, so to speak, in electron flow happens at cytochrome 1. So when you give people NAD, you're basically opening up the free flow of the traffic. So now you can exchange more electrons for protons, and you can run those electrons down from cytochrome 1 to 2 to 3 to cytochrome C oxidase to cytochrome 5. Now it's easier to make ATP. And as you make ATP, you feel better. You're going to have more energy. Life gets easier. And that's kind of the oversimplification of where NAD fits into that. And it seems that the majority of people, again, this is just, I'm a clinician, so I'm just observing what people do. When you give them NAD and we do a loading dose intravenously, when they come back after the loading dose, the vast majority, things have gotten a lot better in their life. So it would make sense to me then that the traffic jam is happening at cytochrome 1.
Well, and I know you mentioned nervous system, but I think it's important to highlight that mitochondrial health and function is so critical for really every system of the body. And then there are some systems that are really even more dependent upon mitochondrial function than others, depending upon how many copies of mitochondria are in a cell. Reproductive health is a big one. When we see hormonal imbalance, actually, we've seen a lot of underlying deficiencies in NAD that you can even get people in the fertility world, they're seeing restoration of
100%.
ovarian function. I mean, when you're focusing on
Yeah.
supporting these systems. So it's
Yeah.
definitely really interesting.
Yeah. I think we've helped many, many couples get pregnant using
Mm.
NAD for sure.
Yes. Not surprised. Not
Yeah.
surprised.
Yeah.
So this ended up feeling, I mean, I think in our world, we're talking about it almost like it's a magic bullet. And it sounds like most people can benefit from,
Yeah.
increasing their exposure. Are there any patients where you're thinking like this is probably not a good idea for them?
So the only 3 contraindications we found are pregnant women. So we don't like to give things to pregnant women in general. Congestive heart failure and chronic kidney disease, not because of the NAD itself, but because of the fluid requirements if we're putting NAD in 500 cc's of saline.
Mm,
During the pandemic, we obviously continued doing intravenous NAD, but then we were shifted to doing more at home, like peptide shots. So we're doing more patients are doing it at home where they're giving them self-injection subcutaneous NAD. And so that honestly, outside of pregnant women, I don't think there's any contraindication. Literally. We
that's
mean
great.
there's no medicine, no diagnosis outside of that. Again, doesn't mean it's going to work for everyone. No, if you're a 25-year-old super healthy and fit and you do NAD, you probably won't feel it because you're super healthy and fit. Does it mean you could benefit from it? For sure, but you may not want to continue it because you don't see the benefits right in front of you.
Well, right, and when you're weighing the cost to the benefit, you will
Exactly.
see a bigger impact when you have, later on in life when you start to have a little bit more deficiency or
100%.
deficiency in energy production even.
Yeah. And so you take a 55-year-old male who's stressed out, who's, lived 55 years, in general, they respond very well to NAD. It's
Mhm.
like the light turns on, you see it come back in their eyes and they feel their coloring gets back. They feel so much better. That's what they subjectively tell you. A big hole here is, we don't have a way to measure someone's NAD status, right? And it's been a problem, but hopefully that gets, remedied at some point.
So that's interesting. Right now, what are you utilizing to kind of determine how frequently someone might need an infusion?
Yeah, I mean, again, it's we don't have any objective measure outside of, just from doing this a
Looking
lot.
at
What we came up with is, what works best is when people do a loading dose, 5 treatments in 10 days. And then on average, people do 1 treatment a month intravenously. Now we have plenty of people who do more and plenty of people who do less. But on average, that's about right.
Are there any other therapies that you find that are just really helpful and relevant that you're looking at all the time? I think about like some of the peptides, like BPC 157 is another one that gets utilized very frequently with especially joint issues and kind of
Mhm.
restoration. Are there others that stand out to you that you think people really need to know about?
Yeah, I mean, we love BPC until the FDA pulled it. So now we're using the new BPC, which is called pentadecaarginate or PDA. It's very similar to the BPC molecule. I think, if you had to ask me, people are coming back and seeing faster results with PDA compared to BPC. So I think we're off to a really, really good
That's
start.
great.
Yeah. I think people are getting into methylene blue. It's not a peptide,
Mhm.
but it's a mitochondrial enhancer, whereas NAD works on cytochrome 1, methylene blue works on cytochrome C oxidase or cytochrome 4. That's like a super nutrient, right? That's going to up level the effects of the mitochondria. Helps with oxygenation. It's antiviral. It's anti-inflammatory. I think there's going to be some data anti-cancer. Very, very safe. Different than NAD, it can be absorbed orally. So most people can take methylene blue orally and get amazing results. It's also a cognitive enhancer. So that's something we're doing a lot of as well.
Hmm. That's why that's what you can say you have
Yeah.
that
In the
backdrop for
background. Yeah, exactly.
to reflect the importance of methylene blue.
Yeah.
That's great. Anything else that stands out to you for really kind of exciting nutrients that are up and coming?
I don't know about nutrients. I mean, we're always playing around with different nutrients, but I think it's the combination. Like what we're interested in is how do you combine these different energy devices like PEMF and different, light devices with different compounds to maximize how things are utilized and working. So that's kind of our next goal is, starting to figure some of that out, because whether it's people do sauna and cold plunge, or they do, PEMF, red light therapy, it's obviously becoming way more popular. It's how can we maximize that? Can you take something and get under the red light and really, synergistically improve the outcome? Yeah.
Well, hopefully we'll see some data on that in the next 5 to 10 years for
Yeah,
sure.
I think so. I think that's the next big push.
Another kind of interesting question. Have there been any like health trends that you have a lot of patients come in on that you're like, meh, really wish that people weren't into this as much as they are?
I mean, it's happened over the years with, I don't know. I've seen where a couple years ago was Epstein-Barr virus, right? Where everyone thought they had Epstein-Barr virus, which is real. Like reactivation of Epstein-Barr virus is real, but I don't think people realize how rare it is to actually have, lab, diagnosed, where your titers have to be certain titers a certain way to actually have reactivation of Epstein-Barr. I'm not, the jury's out for me on mold. Mold's the big thing now. I'm sure there's a lot of mold illness. I think a lot gets lumped into that, right? It was it seemed to be, it went from Lyme to Epstein-Barr, now to mold. I think the underlying theme there is there's a problem with inflammation. These people's immune system. And so it doesn't necessarily matter what the instigating effect is. It's more of like what's not getting better and how to like rework an immune system that's, unstable or not responding appropriately.
Yeah, it's a great way to think about it because ultimately we should be able to handle exposures,
Totally. I totally
through
agree.
detoxification and our immune system function. We are made to be able to process through exposures like that. And if we're
Yeah.
not doing that well, is the problem the agent or is the problem our system?
Right. And it's hard to tell. And so it's easy, right? It's easy to say, well, I have mold. It's harder to say my immune system's not keeping up. And it's just a symptom of a worse problem.
Great. Awesome. Well, I've really appreciated your time today. I've learned a lot, and I think
Oh,
our
good.
listeners have too. If they want to learn more about your practice or how
Mhm.
to reach you, what are the best ways for them to do that?
Very easy. Our website's koniverwellness.com. It's the same on Instagram. That's where we're at. I'm the one who posts. I don't keep up too much, but we certainly can be reached that way. But our website will hopefully make it pretty easy for people.
Fabulous. Thanks so much for all you do and with your patients and for
Hmm.
spending the time with us today.
Thank you for having me. I appreciate it.
If you're wanting to learn and really expand your expertise in hormones, you're not going to want to miss our podcast. So make sure you tune in each and every week for our new content.